My name is David Brown, MD. Until January of 2022, I was a professor of medicine at Washington University in St. Louis, and have been the director of cardiac intensive care units in both California and New York prior to coming to Washington University.
Hi there, my name is Dr. David Warriner, and I'm a consultant cardiologist based in Yorkshire in the UK. I subspecialise in imaging such as CT and TOE, and on that basis I work in Doncaster and Bassett Law NHS Foundation Trust, teaching hospitals at Doncaster Infirmary specifically, and I also subspecialise in adult congenital heart disease, working at Leeds General Infirmary, which is part of Leeds Teaching Hospitals NHS Trust.
This book is meant to be a guide for those who work in cardiac intensive care units, or what used to be called coronary care units. In fact, this actual month is the 60th anniversary of the development of the first CCU in the United States, which was an area to put patients with a single diagnosis, that is acute myocardial infarction, so that they could be observed for the development of potentially fatal arrhythmias. As you will see from the handbook, the breadth and depth of the patient population that now enters a cardiac intensive care unit has gone well beyond that of acute myocardial infarction. Thus, the need to publish textbooks and handbooks that delve into many of these causes of acute cardiac illness in patients. We hope that this handbook will be helpful to students, residents, cardiology fellows, and even cardiology attending physicians as a first stop to get some background information on patients they may be caring for in the cardiac intensive care unit. Because of its size, it's by no means exhaustive, and we strongly recommend that you pursue more in-depth knowledge by going to the medical literature about specific issues with your specific patients. In the handbook, you will find 25 chapters of specific disease entities or chapters on procedures that may be necessary for patients in the cardiac intensive care unit. These will aid you in the care of a very high percentage of patients you are likely to encounter in the cardiac intensive care unit, but there will always be the rare patient, the unusual patient that will require you to go beyond the handbook to either the medical literature or more complete textbooks of cardiology or cardiac intensive care unit medicine.
I'm really excited to introduce you to our new book by myself and Professor David Brown, which is the Manual of Cardiac Intensive Care, which we feel addresses many of the issues for patients presenting with acute cardiac disease and for the doctors and nurses and allied health professionals that manage them, either in ED, in coronary care, in ICU or cardiac intensive care units across the UK and of course America and the rest of the world. We feel this book is completely unique as it covers many of the major areas in cardiovascular disease when patients present acutely unwell, such as cardiogenic shock, acute heart failure, acute valvular disease, acute aortic syndromes such as dissection, cardiac tamponade, cardiomyopathies such as Takotsubo, cardiorenal syndrome, myocarditis, etc. So covering all the major areas really. It's heavily evidence-based by experts in their field, and it draws largely from Professor David Brown's very important work, which is cardiac intensive care Cardiac Intensive Care textbook. And it also covers key procedures in patients that would require central lines, radial lines, pericardicentesis, temporary wires, etc., and also invasive monitoring and how you would interpret them. I think significantly there's lots of images and videos also, if you have the ebook, which you can access on a variety of different devices. And I think the images and videos really bring home the complexity and the nature of these diseases, which I think sometimes words are difficult to explain. The book's well divided up into each of the key areas, and it's subdivided very well as well, including common misconceptions, the clinical presentation, pathophysiology and management. And I think it'll be very well received by all specialists, subspecialists and generalists who are interested in this area, and also allied health professionals such as nurses, advanced care practitioners, ODPs.
Dr. Warriner and I both feel that the cardiac intensive care unit is one of the most dynamic and exciting places to practice cardiology, and that's why we were enthusiastic editors of this handbook. We hope you will enjoy it and learn from it, and your patients will benefit from you having access to it while you're actively taking care of them.
To all medical students out there, I can't recommend this book highly enough, really. It's based on David Brown's earlier work, textbook of cardiac intensive care, which is without doubt one of the most interesting books about medicine I've ever read. And I've read lots of books over many years in medical school and over the 16 years since qualifying. There's so many interesting nuggets of information, so many useful figures, so many useful statistics, etc., which are all heavily evidence-based and drawn also on a vast experience of leading experts in their field. I think it'll be a very useful book to have on placement in cardiology, and you'll be able to understand why these patients are behaving like they are, what treatments are being done and why, and what complications you can expect, and how these patients can actually get better care in the right hands. And I think having this book at your disposal will certainly improve your knowledge of cardiac disease and your confidence and approach to these patients who are often acutely unwell. I think due to the number of different pictures, the algorithms, the figures, the videos, etc., I think it's unlike any other book out there, really, certainly from a cardiac disease point of view. And I think the ebook as well helps consolidate the information that's in the book, and it's very well illustrated, and I think you'll really enjoy reading it.